as far as getting the best out of students is concerned, we had different perspectives. And the one that I chose to share today is the effect of assessments on student motivation. And what Anna talked about, what Malu talked about and what Anna talked about, I sort of build on it. So you heard about reflective zombie. Now I'm going to talk about what assessments do to student motivation. So what I did was I performed a review on effect of assessments on student motivation in health professions education. These were my co-authors. So we tried to have a very interdisciplinary team so that we could get different perspectives. Someone was an expert on the theory, someone was from the practice, someone was, Case van der Vloten is the assessment expert in health professions education, etc. What I would like to start with is, in health professions education, there are different types of, catchphrases being used, like assessment drives learning. In fact, I think the Groningen or UMC Groningen assessment is based on assessment drives learning, assessment of learning, assessment for learning, and assessment as learning. So you can see a reference which I have put below. It's on whole of higher education. And I think probably it's a PhD student from of Marika van der Schaaf. But what they did was they performed a review on what assessment is, what are the three terms: for learning, of learning, and as learning. So what we see in this whole story is people are trying to look at what assessments, what happens, how does assessment really influence learning? But in this whole story, what is not dealt with is what is it doing to student motivation. So I started my review with the hypothesis that high stakes testing hampers intrinsic motivation for learning. And this hypothesis is based on self-determination theory of motivation. My specific research questions were, how do assessments affect student motivation for learning in health professions education? What outcomes does this lead to? In which context? And what mechanisms underlie the effects of programmatic assessment on, not programmatic, just assessment on student motivation. So basically what we are looking at, what I wanted to know is in which context, through which mechanism leads to what outcome. I will try to skip the little bit of the theoretical framework. This is the self-determination theory continuum. And the only thing that I want to discuss here is on the most right-hand side of the continuum is what is called autonomous motivation. And autonomous motivation is when someone does something because out of genuine interest or because he or she finds it personally important. And on the left side of the spectrum, you have what is called a controlled motivation. And controlled motivation means someone does something out of internal or external pressure or for rewards or to avoid punishment. So this is the main thing that I used from the framework was, do assessments, what features of assessment stimulate autonomous versus controlled motivation? And autonomous motivation is the desirable type of motivation because it is related to better learning, better performance, better academic achievement, and positive well-being. My strategy included using 3 searches where they combined. So you see the middle triangular part, that is what I looked at. So it was assessments, motivation, and health professions education for students. Results. So this was my Prisma diagram. I'm not going to spend time on this, but I got around 8,328 titles and abstracts. And in that, finally, 24 articles were included in the review. And the characteristics of included studies were, who were the people who were included in these studies. There were medical students, there were nursing students. Some articles had medical and nursing students. There were veterinary medicine students, pharmacy students, nutrition students, health sciences, dentistry, and physical therapy and physician assistant. So these were the, I'm sorry about the noise. These were the different professions which were included in this review. There were 11 studies from Europe, 3 from USA, 2 from Canada, 3 from Asia, 4 from Australia, and 1 from the Middle East. Now, my main results were as follows. So first I looked at assessments which stimulated controlled motivation, or features of assessment that stimulated controlled motivation. What did I find in the context? So I found that mere presence of system for assessments already triggers controlled motivation. The presence of grades, high stakes assessments, so summative assessments, strong focus on factual knowledge. So instead of asking applied knowledge or practical knowledge, if factual knowledge is asked, that stimulates controlled motivation. If there is a competitive element, it stimulates controlled motivation. And all types of pressure, performance pressure, time pressure, emotional or external or internal pressure. The other thing that I found was fear of disclosing lack of knowledge or failure also triggers students' controlled motivation. And another interesting thing that I found, especially in interstable professional activities, was that the students feel conflicted between preparing for their own clinical profession, that means to actually handle patients, versus what they need to do to pass the final examinations. I'm going to skip the next. I will go to mechanisms. So how in this context, what are the mechanisms that steer students towards controlled motivation? So that is by forcing people to spend time on the learning that is required for the assessment. Again, study to pass assessments, then comparison with peers, fear of failure, etc., and encouragement of a surface or strategic learning. And what are the outcomes that this leads to? So the outcomes are higher effort driven by external pressure, but the higher effort may not be in the right direction because it leads to surface and strategic learning, undermining of student engagement and learning, which I find very important. Also poorer mental well-being, feeling of pressure to study, anxiety, frustration, stress. And the next two I find very important: creation of a performance culture, which comes at the expense of learning and development. And I think Anna had also, Malu talked about this as well, that there is a culture which comes at the expense of real learning. And then undermining of learning potential of an assessment program, that also happens. So I think these are crucial things that we really need to realize when we are planning assessments. Then there were assessments which stimulate features of assessments that stimulated autonomous motivation. The context was that assessment need to be, first of all, interesting and challenging, innovative, mastery based. Mastery based means when you try to become good at something because you like it and not because you want to show others. That is performance based. And they need to be longitudinally arranged, not that there is one course at the end of it, there is an exam. No, all the exams need to be related to each other, and that they are introduced in a seamless manner in the curriculum. They embed facets of student autonomy. They directly build competence. There are individual goals and there are shared goals. They are jointly constructed between the learners and the teachers, and they have authenticity with clinical practice. So, and they hold personal value for students. These were the types of context in which the autonomous motivation was stimulated. And the mechanisms through which this happened was through personal motivation. The students had some personal interest in doing those things, so that motivated them. There was autonomy in learning by giving feedback through active learning, and authenticity with practice, and peer or shared learning. These were the mechanisms that led to the outcomes of higher creativity, skill development, fostering of self-regulation, time management, mastery learning, etc. Interest in the topic, which is intrinsic motivation, better learning approach, higher effort in the right direction, increased quality of work, goal setting, better error identification, etc. So on the basis of this, of course, I've run through very quickly through the findings, but the recommendations that we could give to educators and policy advisors are, so features of assessments that stimulate controlled motivation, like uninteresting low challenge, convert it to interesting challenging features, assessments. Abstract theoretical assessments should be converted to authentic practice-based assessments. Assessments that are irrelevant to practice should be replaced by relevant to practice and transferable to practice assessments. Constructed by teachers, it would be better if they are co-constructed by teachers and students together. Individual can be replaced with collaborative assessments with shared learning. Instead of implementing them per course, they should be implemented longitudinally in the study. Instead of having assessments that do not hold personal value for students, introduce assessments that hold personal value for students. Try to support student autonomy. So replace assessments which don't have student autonomy to ones that have student autonomy. Replace high stakes assessments with low stakes assessment. That means summative with formative. remove grades and move to a pass-fail system. Strong focus on factual knowledge, move it to focus on practice-relevant knowledge. Change performance or time or emotional pressure-related culture to basically just get rid of all the types of pressure that are present. Reduce the competitive element in a curriculum or in an assessment. Fear of disclosing, lack of knowledge or failure. To overcome this, try to encourage a culture of mistakes are good or that failure helps you learn. And if there is conflict between preparing for clinical profession and to pass exams, that can be overcome by designing assessments which test knowledge that is essential to practice. So these were the recommendations, practical recommendations that we came to in the review. Now, the last thing that I would like to leave you to think about is that we start with students since they are really small. They transition from pre-primary to lower primary school, from lower to upper primary, from upper primary to high school to higher education, and then from student to working in the practice. At these transitions, what do we do to them? We hammer them with assessments. You have to learn for assessment, you have to learn for assessment, you have to get grades, you have to pass, etc. And what this does is actually we create an assessment monster. So by the time the student comes to us in medicine or nursing or any other health professions education or any higher education, what we receive is not students anymore, we receive assessment monsters. So if we don't want this to happen, we actually need to change the culture right from the schools and not just in the health professions education. So this is the thought that I would like to leave you with. I'm going to skip the further research ideas, and I would like to thank my group for all their support.